So can I start, sir?
Yes.
Yes.
Good afternoon, everyone. Myself, Dr. Shilpa, Lenus, postgraduate in general medicine from Sri Venkateshwara Medical College, Tirupati. I am here to present a case of pupil-sparing oculomotor nerve palsy in a COVID-19 patient. COVID-19 caused by SARS-CoV-2 is associated with so many neurological manifestations, of which cranial nerve palsy is a raising concern. Oculomotor nerve palsy is very rare in patients with confirmed COVID-19. We report a case of pupil-sparing oculomotor nerve palsy in a patient with SARS-CoV-2 virus infection. Coming to the case report, a 60-year-old female with no previous comorbidities started complaints of low-grade fever of 5 days duration and was diagnosed to have COVID. She was treated for the same for 7 days with tablet doxycycline, ivermectin, dexamethasone in a government local hospital, and she was discharged advising home isolation. But after 10 days of symptom onset, patient started complaints of drooping of left eyelid associated with diplopia of acute onset and was referred to our hospital. On examination, vitals were stable with pulse rate of 92 per minute, BP was 130/70 millimeter of mercury, saturation with room air was 96%. On examination, wrinkling of forehead was present with left eye ptosis, left eye was down and out, extraocular movements revealed restricted upgaze, adduction and downgaze of left eye. Pupillary reflex was intact, both direct and consensual. Fundus was normal, pupil-sparing oculomotor nerve palsy was diagnosed. No other cranial nerves was involved and rest of the CNS examination was unremarkable. On investigations, CT chest showed moderate grade non-specific pneumonitis of CT severity score 11/25. MRI brain showed diffuse age-related cerebral atrophy. Both MR angiography and MR venogram was normal. Blood investigations were normal except increased inflammatory markers of CRP 18.23 milligram per deciliter and D-dimer 2.3 gram per liter. FBS was fasting blood sugar was 92 milligram per deciliter and postprandial blood sugar was 110 milligram per deciliter. Patient was treated with remdesivir for 5 days, IV steroids, enoxaparin, vitamin C and zinc supplementation. Diplopia gradually improved, but ptosis still persisted. She was discharged with tapering dose of steroids and was advised physiotherapy. She was followed up and ptosis improved slowly, which became normal after 3 weeks. So, conclusion, COVID-19 can cause neurological complications like cranial nerve palsy, and conservative management with proper physiotherapy can lead to complete recovery in third cranial nerve palsy. Thank you.